Hi, everyone. Thank you so much for joining us for another edition of Adam Interviews, where we are talking with people who are doing exceptional things in our community or are visiting our area, bringing their exceptional talents to our neck of the woods. Joining me right now, though, we have a very special guest. This is Dr. George Kornfeld. He's an optometrist in the area. And George, I want to thank you so much for taking the time to come in and talk with us today.
My pleasure.
The reason that we brought in Dr. Kornfeld is because not only is he good at what he does, but he's a low vision specialist. And what I mean by that is he has advice that he can give to folks on how to perhaps bring back or enhance or use what vision, what light sources out there to benefit them. And look, low vision, as we know, it can be because of what I have, a genetic predisposition to it, a inherited disease, or a lot of people as they get older, their eyes deteriorate. And Dr. Kornfeld, if we can just kind of talk about from your office, what type of issues do you see, before we get into the solutions, what type of issues do you see most of?
I would say the conditions that I see mostly are macular degeneration, age-related macular degeneration. That's the updated name for this condition. It used to be not as nice a name. It used to be called senile macular degeneration. It's low vision, but macular degeneration is the main one, and that is for the elderly. It does happen to younger people, and that condition would be called Stargardt's, which happens to people in their teenage years and follows them through their life. And basically what those conditions do is that takes away your central vision. In addition to that, I see patients with diabetes, patients with glaucoma, patients with cataracts that for whatever reason are not going to be operated on, whether it's the patient's choice or whether their physical condition doesn't allow for it.
So as I've told the public before, I have Stargardt disease. So it is central vision. Mine is like a bullseye where I can see 20/20 within the donut, if you will, but there's a circle. It's almost like if you take your glasses and you put like Vaseline, like little circles within those circles, I can't see. Or no, with on the rims there, I can't see, but I can see through, and I can see my periphery never changes. But does it present like that in the elderly, or when you have age-related macular degeneration, is it different?
It really is the same. So my experience is that you lose your central vision.
Mm-hmm.
So what you're looking at, you might look at a person's face and you don't really recognize them.
Mm-hmm.
Or you look at television, you can't really see it very well. You would probably be prevented from driving because you don't see well enough in the central vision. But that's what macular degeneration does. It takes away the central part of your vision, leaves the periphery intact.
Yeah.
And when that's intact, I take advantage of it. And I use that in my corrections.
All right, so let's talk about the corrections. How does that conversation start with a patient?
Well, I ask all patients, and they call the office for an appointment. I call them back, and I talk to every patient before I see them. I want to make sure that there's some way that I think I can help them. If I think I can help them, then I offer them an appointment. I tell them what's going to be involved, how long it's going to take, what they might expect as far as expenses, and they tell me what their wish list is. What would they like to achieve? And that's the main goal, because I want to solve that problem for them. Whatever they want to be able to do, I want to help them to be able to do it. And that involves reading, writing, seeing family pictures, watching television, seeing grandchildren in performances, sporting events, and driving.
Mm-hmm.
And a lot of people wonder, well, wait a second, how can they drive? I would not like to see anybody driving with one of these low vision devices. Well, basically, you would fit them with what's called a bioptic telescope. Telescope is a lens that moves the image off the central area onto the periphery, which is still working. And they're able to identify things. They don't look through the telescope all the time while they're driving. They are looking underneath the telescope, and because that's where they have their peripheral vision. And you need peripheral vision to be able to drive. To look and see straight ahead, you might get an idea, but if you can't see the traffic light, or you can't see a bike, or you can't see a person, well, then you have to tilt your head down, and you lift your eyes up and look through the telescope. And that's when the telescope comes into play. I have an example of it if you'd like to see what that looks like.
100%. I've heard about this device, and I've actually never seen one in person.
So where do I hold it? Oh,
There you go.
okay. Let me get it right over here. So that is what's called a bioptic telescope.
Mm-hmm.
Oh, it's moving away.
Yeah, you got it. I know it
we
moves in reverse there.
So that's a bioptic telescope. So if someone's going to drive with us, they're going to look underneath, and that's for their general driving. And then if they want to see the details, they want to see a street sign, they want to see a street light, they want to see a traffic light, they want to see a car, then they tilt their head down. Oh, now we can't do this very well. Oh, okay, tilt their head down and look through the top part, through the telescope.
Mm-hmm.
And now they're limited because that takes away from their side vision.
Mm-hmm.
So you can't keep on looking through that. But then you tilt your head back up and you look underneath. You get to the bottom part of the lens. So that's how it works.
Interesting. Can you use that for faces and things like that as well?
Yes, you can use this for faces. Now it's sort of a neat looking telescope because it's sort of smallish.
Mm-hmm.
Now there's another version of the same kind of thing, which is a bigger, same power. Oh, I've got to get this in front of the camera. And that is called a bioptic wide angle.
Okay.
You can see it's a wider angle, a bigger telescope, and it's the same power. Now, one of my favorites is that was a 2.2x telescope. One of my favorites is a 3-point telescope, 3x, and it's bigger. Let me see if you can see it like that. And it's the same idea where you look underneath, and then when you need to see something, you tilt your head down and look through the telescope.
Now, my question to you is this. When you're driving, if you look through the telescope, does that perhaps show you if it's a car ahead of you, it'll look closer than it actually is at that point?
I don't think so. I mean, it just enlarges it.
Oh, okay. Gotcha.
It enlarges it. So that's a 2.2x or a 3x. You can get a 4x. You can get large, 5, 6x. When you go larger, they're smaller and they're more tubular.
Yeah.
And these are small. These are called miniature telescopes. And they're amazing because they really enable people to do things that they didn't think they'd be able to do.
Absolutely.
And now I'm going to talk about one other condition.
Oh, please. We have time.
Oh, I know. Which would be, what if you had retinitis pigmentosa?
Yeah.
That's just the opposite. Retinitis pigmentosa, you have your central vision. You might even see 20/20, but you lose your periphery. So you can't see on the sides, and you're going to bump into things. You're going to bump into walls. You're going to bump into people, and you want to somehow widen the field that you have. And you do that by a similar kind of telescope. I'm going to try to hold this up so you can see it. I've got this. There we go. So it's
fascinating.
A little hard to see, but I'm going to turn it like this because in the back, it's the same telescope turned backwards. So if you ever took a binoculars and you turned it backwards, it makes everything smaller, farther away, but wider.
Yeah.
So where you've lost the side vision, a telescope like this will widen your field of view.
Yeah.
And this comes in several different powers, similar to the other ones. We just turn them around, mount them again in the eyeglasses so that you can see the telescope. This is the bioptic reverse telescope.
Truly remarkable. Are these expensive, and does health insurance ever cover any of this?
My experience is that health insurance doesn't cover very much of these glasses. These are very expensive glasses. And I would say that if we talk about how much they are, they're going to range I would say up in the $2,000 range. They're all custom made. Somebody has a prescription that gets built right into the telescope.
Yeah.
So it's both in the telescope and it's in the lens underneath. So if they need the power in the glasses, that goes in there and in the telescope. And so you take care of it that way.
Yeah.
So very interesting case that I once had was somebody came to me and he already had a telescope and he was very nearsighted. And I asked him, did anybody ever try to fit you with contact lenses? And the answer was no. I said, well, if you'd be interested in that, I'd be happy to work with you. So I fit him with contact lenses. I was able to take his power from inside the telescope out. We made the telescope with no power in it because all the power was now in his telescope, in his contact lenses.
Contact lenses, yeah.
And he was able to then get around without wearing the telescope all the time. And he now wears the telescope only when he drives in an area that he's not familiar with.
Mm-hmm.
And in general, that brought his vision to a certain level that he could drive legally without a telescope. So I'm going to just talk a minute about what happens with driver's licenses.
Yeah.
Because there are different kinds. We typically, normal eyes, vision is 20/40 or better. And then you get a regular license. You go to the DMV. They don't ask you any questions. You just read the letters and you get a license. They don't care about whether you can see on the sides. They don't ask you that. They should, but they don't.
Mm-hmm.
Somebody who has RP will pass the test.
Right, of course.
They'll bump into things. And the next category of license is between 2040 and 2070. This is New York State.
Okay.
2040 and 2070, in which case you can get a driver's license, but it has to be renewed and reviewed every year or 6 months, depending on relationship between the doctor and the patient. You decide that goes on the form to Albany.
Mm-hmm.
That has to be a form that the people at the DMV don't want to talk to you. They see your vision's below 2040 and they say, go see your eye doctor. So when they come to my office, I have to fill out this form. It's 2040 to 2070. And then they also want to know how wide is the field.
Right.
So your field of view has to be 140 degrees. So if you have 2040 to 2070 and you have 140 degrees, you get a medical license. It has to be reviewed and then they contact the person. And the next category is a telescopic driver's license. And that is if your vision is between 2070 and 2100. Regular vision, looking at the eye chart, and you get 2100, and you also have 140 degree field, that is a legal driver's license potential for New York. Now, when you get that, and you're restricted to driving with a telescope, you have to do that within 60 days. And you have to have a training. There's a few places where you can get training for that to make sure that you can do it. And then they will sign off on this DMV form. One time they said, oh, just sign it. Asked me to sign it. And that goes into Albany. And then you have to have a road test. So you have to have a road test with a telescope to prove to the instructor that you know how to drive. So that's the driving rules for New York.
But you can do it with the devices you just showed me.
Yes, you can get a driver's license with this. Oh, I got to put it in here again.
You'll get it eventually.
With that.
Yeah.
Oh, I'm sorry.
There you go.
Where is it?
So if you see someone driving with this, don't be alarmed.
Don't be alarmed. Some people say, I wouldn't want to see anybody driving with that, but at the same time, it's legal. The people who come to me most often are the kids with, either albinos or children, youth, teenagers, 16 years old, with nystagmus or Stargardts.
Yeah.
Because when they get to their 16th birthday, they want to be at the DMV office like all their friends. Yeah. Because they want to get the permit so that they can learn how to drive. And if they have these eye conditions, they have to have a special license.
Yeah, absolutely. Is RP, I know there's genetic gene therapy that has cured one eye condition already. Is RP, the one you just mentioned, is that one of them? So kids who are born with it today, if they get the gene therapy, they largely won't see the impact of that, or is that another type of disease?
I have to admit that I don't know how that impacts their vision.
Yeah, I don't want to give. There's one, I can't remember whether it's RP or not, but when it comes to therapies and things like that, obviously you start to scale up or over to like ophthalmology and things like that. But are you encouraged by the treatments that are out there beyond just the devices?
Well, I'm encouraged that they're working on it. And, it's very nice when you hear that possibly somebody can have a cure. The people that I see, I rarely see that they have cures.
Right.
They basically are not. I'm less interested in that than I am in helping them to do the things they want to do. And actually, a lot of times they'll walk out of the ophthalmology office and the doctor will tell them that I can't help you anymore. And that's the time that low vision really can step in and help them see and do the things that they want to be able to do. Because the medical correction is good. The injections that people get for macular degeneration, the wet kind, now the dry kind, it's all very good. But their bottom line is they want to see.
Yeah.
So that's why this is all, to me, very important.
Yeah.
I want to just mention
Please.
I don't know, it's a fact, from research. How many people have low vision, visual disabilities in New York State?
I'm
What would
very
you-
curious.
What would you guess?
Guess. 5%.
Oh, I don't have a percent, I have a number.
Oh, you have a number. Okay. Go ahead.
493,000.
Wow. Okay. 500,000.
500,000. So that's the people who could benefit from low vision services.
Yeah.
And unfortunately, there are not enough of us out there who are doing this, that are helping people, achieve what they want to achieve. When you help them, it's amazing. I mean, that's my approach, and that's the way I feel when I help somebody do something. So you always have to think out of the box. So I'll tell you just anecdotally. So I saw a person a few weeks ago that actually had cataract surgery. So one eye was corrected for distance, one eye was corrected for close. And her distance eye was starting to get worse.
Okay.
And that was when she needed for driving. So so I'm going to fit her with a telescope and see how good can I make her vision. And I put a telescope on one eye. And I said, well, wait a second. Can I equalize the telescopic correction with the other eye? That's a reading eye.
Mm-hmm.
And I said, well, I'm going to try because I have nothing to lose to try. So basically, the implant was for close work. And I took a lens and she had a telescope on. And I put a lens in back of the telescope that sort of neutralized that reading lens to zero.
Wow.
And all of a sudden, she just lit right up. And what was happening was, and then I refracted her eyes to get the right and best prescription for her. The bottom line was that she had better vision in her reading eye than in her distance eye.
Mm-hmm.
And I said, well, here's a prescription for you. Go home. And she had come 70 miles, not to here. I saw her in Clark Summit, Pennsylvania, which is another place that I see patients. So I gave her a prescription for the distance eye and for the reading eye that made it a distance lens. And I said, well, go home, fill that prescription today, and go ride your bike this afternoon.
Wow.
Because she wanted to ride her bike and she wanted to drive. But she now has vision that is within all the limits as far as getting a regular driver's license. She was a happy camper.
Absolutely. This is remarkable. What do you think about the other types of aids that are now coming out, the meta glasses, things like that? They don't necessarily improve the vision, but they'll provide information. They can kind of guide you by saying, you say, read this, and it'll have a little speaker, it has the camera.
That's for people who are very blind.
Okay.
I mean, their vision's very limited. I've seen these things, and I've demonstrated it to a patient one time where you point your finger at something and it reads it.
Mm-hmm.
And they're very technical and very expensive. And, if you have no vision, they're great.
Mm-hmm.
And I know of somebody who has a device that he wears on a pair of glasses. He calls somebody on his phone and connects to that person. And wherever he looks, that person will describe what he's seeing.
Wow.
So that takes place of his eyes.
Yeah.
So I was in a room with this person, and I knew he was going to do this call. So I had my camera, my phone, and I'm videoing the whole thing.
Yeah.
And what the man on the other line said. Oh, I see you have people in the other room, because this was a holiday get together. People in this room, people in the other. He said, I see there are other people in the next room, and there's somebody taking a video. So he was aware and watching everything going on.
How interesting.
So I said, that was me. I was taking the video.
Wow. Yeah, I've heard of people going into grocery stores and having that person on the other line saying, okay, you're seeing the Cheerios on the second shelf. Okay, in your hand is the cornflakes.
That must be difficult. I mean, because he's got to maneuver and get around also.
Yeah.
So for looking at things in the supermarket, how do you see things? How do you see the prices up on a shelf way high? And if you have glasses that, let's say sometimes you get glasses that you have to read like this.
Yeah.
And I'll talk about that in a second.
Yeah.
But there's another kind of thing that you can use, and that's like a video magnifier.
Mm-hmm.
Let me see if I can get it in the right place so you can.
Yeah. Perfect. Let me
right about like.
Pop up. There you are.
There we go. And you actually see the name on there. It's Clover 7S.
Okay.
And when you turn it on, I mean, oh, it's right on me. But what it does, this is 7 inches. I don't know if you can really see it very well.
You might have to put it right in front of your face. There you go.
Oh, okay. So you can hold this onto reading material,
Mm-hmm.
and then let me just see if I can just put something up in back here. It's under the camera. I'll try. Oh,
Fascinating. I mean, I'm starting to see it.
oh.
So this will enlarge print,
So
essentially?
the point is, you can make this up to very, very large.
Yeah.
So, and there's little buttons here, a plus and a minus, the plus and minus buttons, so that you
Mhm.
can change the magnification and you can move it along.
Mhm.
It has a stand in the back. They come in smaller. This is a 7, it comes at 5, it comes at 12 inch,
Mm-hmm.
and they come sometimes with a stand. There's a stand on the back of this one, so you can just set it on a table. And there are other ones where there's a stand where you set it on the stand, then you can write underneath.
Wow, fantastic.
So that's, now the thing about the supermarket is you go to the supermarket, you can hold it on the top
Yeah.
shelf and take a picture of it,
Yep.
and then bring it down near you and magnify it.
That's fantastic.
So I mean, the technology is amazing.
It is amazing. What else you got? What else you got in your magic
Okay.
satchel?
I have a couple other things that are very interesting.
Okay.
I want to prismatic reading glasses.
Okay.
They come in small powers, +4, and normally bifocals or reading glasses will go up to +3. In
Mhm.
the store, you can't buy it more than +3. So this starts at 4, and I have them up to about 12, +12. So when you go stronger, I'm going to hold this like this so you can,
There you go.
there you can see that it's got a prism.
Yeah, look at that.
So the prism is in there, and when you wear these, I call these Harry Potter glasses.
Yeah, look at
And when you wear them, you bring the reading material right up to your face, or
Oh, yeah.
depending on the power, how
That's
close you have to hold
interesting.
it. And then you can do this, or you can just read. Now, I have patients who can read anything and everything with these kind of glasses.
Mm-hmm.
Patient who loves this, has it around the neck all the time.
Right.
So if something comes into her view that's small, her regular glasses go up on her hair,
There it is.
and this one goes from the cord on, and then she brings it up close to her face to read.
Right.
Reads books, magazines, anything. And it's an amazing.
It is. These are amazing tools.
And another one, that goes like this or like that. Now, what if you want to read it at 13 inches?
Okay.
You don't want to hold it. People say, I don't want to hold it so close.
Right.
So then the other kind of option is what's called a reading telescope. You've seen the doctors on television, and you've seen your dentist.
Oh, yeah, of course.
They wear
throw that-
binoculars.
Yeah, right. Right,
This is
right.
the kind of thing that they wear.
Oh, my
So
goodness.
there you can see, if I can get it. You can, if I hold the glasses straight, there we go. You can see that it's angled downwards.
Yeah.
And it's a little wider, so it gives you a wider area.
Yeah,
And
I
you
see
can
it.
get reasonably looking frames.
Yeah.
And so this is called a reading telescope. So you can choose the distance. Let's say somebody wants a computer. Somebody wants to have it at 13 and not at 5. So you actually can tell the company where these things are manufactured. I want it at a certain distance, and then the optics are incorporated accordingly. Now, another way to do this. Now, what if you're not going to drive? You just want to magnify things.
Right.
Well, here's one where you can magnify. This is called a full diameter telescope. You cannot walk with it because once you magnify it here, it takes away all of your side vision.
Of course. Yeah.
But now you want to read.
Yeah.
So what do? This is distance only. So then you can take a cap. I don't know if I can do this. I'll try.
You can put it right in front of your face. If you put it right in front of your face, then it'll work.
Okay. So you put a cap right over
Yeah.
the telescope.
Oh, of course.
And then it brings it into a certain distance.
Gotcha.
It says, you can see a +4. This will bring it into 10 inches. And now you can't do this with 2 eyes because this is set for distance 2 eyes.
Mm-hmm.
But when you put this on, you can't converge. These don't move.
Yeah.
So you can only do it on one eye.
Fascinating.
And if the other eye is interfering, you can always make one of these caps that just is a block, an occluder.
Yeah.
So that's cool for distance, TV watching.
Yeah.
You don't want to walk around with it. You don't want anybody to see that you're
Right.
wearing something that looks out of the ordinary. So you have that kind of a lens.
All right. Anything else? We got about 2 minutes left here. Anything
Okay.
else you got?
Very quickly,
Yeah.
a microscope. That's a microscope, one eye
Yeah.
only, because it has to go very close to your face. And you hold that really, I call it nose reading.
Mm-hmm.
You almost touch your nose. And what if you had a stroke
Right.
and you lost all your side vision?
Yeah.
There's something called the side vision awareness glasses,
Incredible.
which is like this.
Hmm.
Get it like that. And I don't know if you can see it, but
Yeah.
there is a prism going up and down. So that what happens is you have to learn how to look into the prism to
Right.
give you information that's farther over on the side that you're not seeing.
Yeah. I can see that. And the human eye, the human brain adapts to this stuff very easily, I think.
It
So,
does adapt to it.
wow.
So I just want to say that
Yeah.
I appreciate talking about this. I've done this for many years, and it's it's made my professional life good.
I bet it has. You've been able to bring vision to people who haven't had it. And what a gift to give. If people want to learn more, where should they go?
Well, you can go on. I do have a website,
Yep.
which they can go and look at. It's called kornfeldlowvision.com.
Yeah.
And there tells you how I got into doing low vision. It's a little history there. It's over 50 years, by the way.
Wow. Congratulations.
And I've started 2 low vision clinics. One was in Cooperstown at the Bassett Hospital.
Yeah.
I brought low vision to that hospital ophthalmology department. And I did live in Israel for a while and started a low vision clinic in a rehab center.
Mm-hmm.
That's, as far as I know, still functioning.
Very good. Well, thank you so much for your time. I personally, of course, appreciate it, but I think a lot of folks out there, if you don't have low vision, you probably know someone who does, a loved one, a grandparent, and I'm sure that they would love to learn more. So thank you so much, Dr. Kornfeld.
You're very welcome.
All right, George Kornfeld talking to us about all of the technological goodies that are out there to help folks, whether it's age-related eye issues or genetic, these can help. And I'm so grateful that he took the time to bring in his little sorcerer's bag there. And we look forward to having him back one day because it seems like there's a lot more to talk about. And of course, thank you so much for watching. We, of course, really appreciate it. Tell your friends and family not just about Dr. Kornfeld's discussion here and all the good stuff that he provides, but also the Rochester First streaming app where we'll continue to bring you great content. All right, everyone, take care. Bye.
Get the Rochester First streaming app today for everything you love from News 8 On Demand, plus exclusive shows you won't see anywhere else. Search ROC and download for free on Roku, Amazon Fire, and Apple TV.